We're going to talk a little bit about something of interest today, and that's the novel coronavirus that everyone is hearing about. I know there's a lot of angst among healthcare professionals, especially EMS professionals, about what to do with a patient that has suspected or known coronavirus. And let me start by saying that it's right now very rare in the United States. There's only a handful of cases in the United States right now. That may increase, but right now there's only a handful of cases. And what is a coronavirus? So coronavirus is a virus that is not new. There are lots of coronaviruses, and this is something that that's globally present all the time. But this is a new coronavirus that has been isolated to a city in China. And some of the other coronaviruses in past respiratory illnesses was the SARS and the MERS viruses. So this is not something that is uncharted territory. It's just a sort of a new subset of the virus. So what do we do as EMS professionals? Well, unfortunately, the coronavirus mimics the flu. It has very similar signs and symptoms as the flu, and right now we're in the midst of the flu season. So how do you isolate, or how do you determine if a patient has coronavirus? I think the number one thing is a good history. Have they been to China in the last 14 days? Have they been around anyone from China, or someone that's been traveled to a country that has known coronaviruses, or this known novel coronavirus 2019 that we're dealing with. Absent a history is probably very low risk and very not a very good chance at all that this patient has coronavirus. I think they probably have a flu or just a normal cold or respiratory illness. So the number one thing is history. And right now we will be adding on the dispatch side an interrogation of the patient, so that we will be able to notify the responding crews that the patient has traveled outside the United States, especially to China. So what do you do with these patients if you did encounter someone with coronavirus? Well, number one thing is protect yourself, protect the patient. Mask on the patient. It does not have to be an N95 mask on the patient, but just a surgical mask on the patient. I think the EMS professional needs to wear an N95 mask, gloves, goggles, just basically good personal protective equipment. Take note that if you're doing anything that may produce aerosols, if you happen to have to intubate these patients, if you're putting them on a breathing treatment or whatever, just keep that in mind, that you really need to wear the mask. You need to have goggles, you need to have gloves. Once you get through with that patient, once you offload that patient to a healthcare facility, you need to wash your hands, remove your gloves, remove your mask. Again, I would wash my hands with soap and water for at least 20 seconds. If you don't have readily available soap and water, the alcohol-based hand cleaners containing at least 60% alcohol can be used to wash visibly dirty hands, visibly dirty anything, gloves or whatever, dispose in the red bags. But the biggest thing is just common sense approach to patients with any type of respiratory illness. And I think this is a good time to even treat those patients that we think have the flu with the same precautions. So I don't want anybody to get overly concerned and overly anxious about this. I do think people need to be cognizant of the fact that we have this in the world now. Very few cases in the United States. It's just something to keep in mind. But again, we're putting things in place from the EMS side that will notify responding crews of possible travel outside of the United States, or possible contact with someone who has been that's been to these countries. And again, just common sense approach. Put the mask on the patient, N95 mask, gloves, goggles. If you want to use a gown, that's fine. But dispose of those. Wash your hands. Just good common sense approach to patient care. And if there are any questions, please reach out to us, and we can certainly give you more information.